Welcome, I'm so glad you all could join me. I'm Chava and you're watching Ask a Midwife. Hi everyone, it's Chava. Thanks so much for joining me. This is the Ask a Midwife channel, and today I'm going to be talking to you about bed rest. Is anyone on bed rest right now? Maybe you're laying there by your computer looking for articles and videos about bed rest. Not too long ago, the American College of Obstetricians and Gynecologists, ACOG, officially recommended against bed rest for most conditions. Some of the conditions that women are commonly put on bed rest would be premature labor, threatened miscarriage, where there's some contractions, maybe bleeding, where they're concerned that she might have preeclampsia, hypertension. Sometimes if a woman is pregnant with twins, they'll recommend bed rest in the end of pregnancy. Sometimes if they see that the baby is not developing well, and they are afraid of intrauterine growth restriction, also called IUGR, they'll also put the woman on bed rest. Studies show that bed rest actually can contribute to other health problems, such as blood clots, degeneration of the bones, weakened bones, and of course depression, other emotional and financial difficulties, and it's not shown to be beneficial enough to risk those things. So it's really, really important that if you have been recommended bed rest, that your care provider, your physician, your doctor, your midwife, that you would have a discussion with them and make sure that they know the most recent recommendations and the studies that back them up. There's something called modified bed rest, and this is a thing. Basically what it consists of is not lying down all day. It's recommended that the woman wouldn't do any heavy lifting, that the woman wouldn't do any heavy cleaning, that she's not going to be exercising, vigorous exercising. Sometimes it would be recommended that she wouldn't drive. Sometimes women do have to quit work early in order to do these things. Sometimes women need to modify their life. Modifications in your daily schedule are actually really good, but the traditional bed rest, like go lie on your left side for the next 2 months, that's actually really outdated, and it's been found that can be quite problematic. There's also something called pelvic rest. Pelvic rest basically means no sexual intercourse, nothing inside the vagina, fingers, douching, something like that. It's really recommended against douching in pregnancy anyway, but that covers it, as well as squatting and different lower body exercises. And that's something where if they see that the woman was having preterm labor or a shortened cervix, those would be things that they would recommend to her. And that's not considered bed rest. It's a modification of her normal routine. It's estimated that 20% of pregnant women are put on bed rest at some point during their pregnancy. So this is something that's really actually pretty common. And because doctors, care providers, and the woman herself feels like there's some kind of element of the pregnancy that's out of her control, whether it's her own health, preeclampsia, hypertension, something like that. They're not sure if she's going to be able to carry the pregnancy to term. There's a lot of helplessness there, and I think that over the years, bed rest has been considered, well, we got to do something, so let's try bed rest. That hasn't proven so successful. So it's good for you to know that bed rest is no longer recommended by ACOG, which is the American College of Obstetricians and Gynecologists, and that if you've been put on bed rest, you should definitely talk to your care provider, have an up-to-date conversation about what kind of modifications can be made in your life to increase your chances of a healthy outcome, while at the same time not raising the risks of weakening your bones, blood clots, and the emotional and mental issues that come along with being bedbound for weeks at a time. It can be really depressing. Also, it can be really financially straining if the woman has to quit work and she needs childcare and she needs house help and she needs cooking help. It can be really a big strain on the marriage. It can be a big strain on the finances of the family. I've seen women go downhill really quick with even a month of bed rest, when their outcome, it probably hasn't changed much from what it would have been if she would have just done a modification of her more strenuous activities throughout the day. I really want to encourage you to introduce things into your life that are going to increase your well-being, whether it be nutrition, hydration, emotional health, meditation, light exercise, and some other modifications that might really help you. And I wish for you that you would give birth at the right time, in an auspicious time, and a healthy time for both you and the baby. I really appreciate your subscribing, liking, sharing this video if it helped you, as well as the other videos on the channel. Thanks so much.